Okay, we'll go ahead and get started. Hi, everybody. Thank you for coming and joining us at the third and final of our February Lunch and Learn series at Chicagoland Healthcare Workforce Collaborative. We have a smaller group today, which is fine, and I'm excited to engage in some great discussion. We are recording, so hopefully some others will be able to benefit from this information as well. I know most of you on the call, but I'm April Harrington, the project manager of the Chicagoland Healthcare Workforce Collaborative. We are honored to have Michele Smith, who is the Director of Workforce and Team Member Development at Advocate Aurora Health, and also the chairwoman of our steering committee at CHWC, host this Lunch and Learn today on behalf of Advocate Aurora Health. And she is joined by Bridgett Beene, the project manager of Workforce Development. Thank you, Bridgett, for preparing this presentation. Very quickly, I think most of you know who we are, but CHWC is an employer-led sector partnership led by 13 of the major health and hospital systems here in Chicagoland. We are supported by over 15 strategic partners, including some of the organizations who I see here today, like Skills for Chicagoland's Future and OAI and CARA. As well as training providers like Midwest Career Colleges. Thank you, Mary, for joining us, and others. Together, we are here to support an inclusive healthcare workforce. We do that by targeting local populations with higher concentrations of unemployment, by partnering with our education and training providers to innovate in the ways that we're preparing our pipeline of our workforce pipeline, and also by focusing on retention and career pathways so that we are offering opportunities to advance up progressive career ladders to quality careers. A couple upcoming events to know about. We have an event tomorrow is co-hosted by Healthcare Council of Chicago and the Chicagoland Healthcare Workforce Collaborative. I'm actually moderating a panel conversation on the next generation of healthcare leaders. I will drop a link to register for that in the chat if you aren't registered already. And then our first quarterly meeting is coming up on March 14th, 8:30 a.m. to 10 a.m. I hope you all will be there. We'll have a lot of information around this year and what we're focusing on at CHWC, including our Good Jobs Challenge Grant Award and updates on that. So without further ado, I will pass it off to Michele and Bridgett to get started.
Good afternoon, everyone. Thank you all so much for joining our Lunch and Learn. And so we will be discussing our team member success program that we have at Advocate Aurora Health. It is a fairly new program. We started the pilot in late July, early August, and the program is going very successfully. And so we thought it would be a great opportunity for us to share with other community-based organizations and health systems about our team member success program, the impetus for creating it, how it's going, the support that we provide our teammates, and all that good stuff. So I will let Bridgett get into more details about our team member success program, as she is one of the program managers in workforce development, and she leads this work with two of our success coaches. And so without further ado, I will turn it over to Bridgett for her to share more about the program.
All right, great. Thanks, Michele. Hello, everyone. Good afternoon. Let me just share my screen here. All right, can you let me know if you could see that? Okay, okay. All right, so thanks so much for the introduction, Michele. As she said, I'm a program manager in workforce development, and I was actually hired, I just made my year. I was hired last year in February to oversee the success coaching program and get it launched. We didn't even have a name for the program when I started, so we've done a ton of work in the last several months, and I'm excited to share some of the details with you. So I'll start off with just talking about what success coaching is. And I kind of broke it down into some sections for you just to make it easier to digest, because it's a big program with a lot of different components. But essentially, it's an in-house coaching program. And we offer support and resources to newly hired team members who might be experiencing barriers to retention, such as childcare, transportation, and food security. We identify specific departments and locations that were experiencing high turnover. And so that's how we decided where to start and pilot the program. We focus on entry-level roles within support services. And so that includes environmental services, food nutrition services, and transport. As of this year, we are actually coaching in all three of those departments. And then the ultimate goal, of course, for success coaching is to increase retention and equity within our vulnerable talent populations. And so throughout the course of this presentation, I'll just talk to you a little bit about how we go about doing that. Obviously, one of the biggest components of our program is the coaching support that we offer. And so through the caring support of success coaches, our participants receive holistic, individualized coaching. And holistic, individualized coaching, I think, is really important for me to note, because really we provide whatever support and resources are needed for each team member, and every team member is unique. And so we want to be able to respond to individual needs. We offer wraparound support. There's a career advising component, and then we also do some essential skill building, so time management, conflict resolution type of coaching with our participants. And we work with them for their first 90 days. In a moment, I'll talk to you a little bit about what we do after the 90-day period, but the program is designed for their first 3 months of employment. Our success coaches have a rotating caseload of approximately 40 team members, depending on the site. And we actually have 2 now, so 2 highly qualified success coaches. Ramian is at the South Chicagoland. He's working within the South Chicagoland patient service area. And so right now he's at Christ Hospital. And then Tanisha is working in Central Chicagoland at Illinois Masonic. So Ramian is just working initially with the environmental services team because Christ is a very large site. And so he manages a large caseload there just with that one department. And then Tanisha actually supports all 3: environmental services, food nutrition services, and transport. And she just started coaching in January of this year. Connections to short and long-term support, and then awareness of internal and external resources is also a key component of the program, obviously with the goal of helping our team members retain their employment. And so ultimately, we want to connect them to, we want to provide immediate support to respond to whatever their need is, but being able to connect them to other resources, create awareness about what's available to them internally, but then also connecting them to some community resources has proven to be very critical and important for the work that we do. We respond to the immediate needs and refer them out. And then in terms of our retention goal, we're looking to maintain a minimum of 70% retention within the program. So that's an overview of what success coaching is. I wanted to also talk to you a little bit about why we have the program at all. And it's really based on data and our experiences within the areas that we're supporting. So in 2021, for example, turnover was very high at 75%, and most of the turnover was occurring within the first 10 days. 2021 was probably a crazy year for a lot of industries, a lot of employers, but we found that within support services, turnover had been consistently high for quite some time. 46% of our turnover reasons are personal reasons. reasons. And so some of them that were highlighted were things like childcare and transportation. And so collecting this data and analyzing it is what helped us to determine what type of support we wanted to offer at the start of the program. There was a support services survey that was conducted over 2,000 team members, and another identified opportunity for our program was that career development conversations were lacking. Team members didn't know how to grow or develop within the organization. They didn't know what opportunities were available. Leaders were not having the conversations, and so that's why it's a component of what we do in coaching. And then in terms of diversity, equity, and inclusion, there was an assessment done with over 1,300 team members. And I'm really proud to say that the Success Coaching Program actually addresses several of the social determinant of health recommendations that our consultants proposed. So transportation, food, childcare, and connecting to resources such as EAP are some of the work that we do within Success Coaching. So that's the what, and that's the why. And so next I'm going to just kind of break down what the steps are to success coaching, just so that you understand what the process is for our coaches and what the team members experience. Obviously, that individualized, holistic wraparound support is the primary focus of what we do, connecting them to the short-term resources, as I mentioned. And so we have funds that we put towards providing that short-term immediate support. We have the asterisk up here for the $350 that we have allocated per team member, but that's rough. A lot of team members, utilize less than that. Some more. It's really just on a case-by-case basis, but that's our baseline. The areas where we offer support right now are within transportation. So we have a partnership with Lyft, and we provide Lyft rides if a team member can't get to or from work. We offer Venture passes, which are passes for our bus and rail system in Chicago. And we also offer, we will be offering gas cards. And so that's a resource that we'll be offering in 2023. In terms of food, and you'll see from the data, food is one of our top needs. We offer grocery vouchers. So they're $30 grocery vouchers that can only be used for food. And we offer those to team members in addition to cafeteria vouchers that they're able to utilize at their site. We partnered with childcare for childcare resources. So emergency backup childcare. If you can't get to work because you don't have anyone to watch your child, we will cover the costs of backup care for you through our partnership. And childcare is very well known, reputable, and they have several locations within close proximity to our sites. Also, clothing is a resource that we offer as well. Specifically at Christ, team members have to wear Black clothing until their uniforms arrive. And we found out very early on that that is a challenge for some team members. And I'll talk to you a little bit about that at the end. But as a result of that, we provide Black t-shirts and Black scrub pants. We have an inventory of them, a variety of sizes for anyone who has a need. And then lastly, Goodwill vouchers. That's something that's new as well. There have been instances where team members have moved into their very first home after being homeless. And how great would it be for us to provide a voucher for them, maybe to get some things for their new home? Or there's a team member who is living in a homeless shelter and started work and didn't have any comfortable shoes and didn't have money to buy any. How great would it have been for us to have the vouchers to help him purchase shoes? This is something new. We just actually had the meeting with them this week, but we'll be moving forward to provide that support and resource to our team members as well. So that's the short-term immediate support that our coaches are able to offer, like that same day. But then for long-term resources and support, we want to be able to refer them out so that they could get additional assistance. Obviously, we do not have an infinite amount of funds or resources for the program. And so it's really important for them to know where else they can get help and support. So obviously EAP has been one of our primary referrals for team members who have all sorts of needs. We have a trauma recovery center, which is incredible. And it's for team members or anyone within the community who's been a victim of intentional violence or crime. And they offer a lot of the same wraparound support that we offer in addition to up to 16 counseling sessions. So they provide a ton of great resources that we've been able to send a lot of team members to. Aurora Family Services is also within the Advocate Health organization, and they do a lot of the financial services and financial counseling work. And then community agencies that help with housing and legal issues and transportation, childcare, food, domestic violence, whatever is needed. And so one big responsibility for me in rolling out the program was to make sure that we were able to identify those resources, know what was available within the community, make contact with them, know what the process is when we refer, because sending our team members to warm referrals or to organizations that we know can support them is very important. And so we've done a lot of that legwork to make sure that we are sending people to the right place. And then additional resources, again, whatever is needed, and lots of things have come up that we didn't even anticipate. But one internal resource that's amazing for team members after their 90 days is Mission and Spiritual Care has something called the Team Member Crisis Fund. So a team member can get up to $3,000 in support from Mission and Spiritual Care, filling out an application. They don't give the funds directly to the team member, but like if you have a car repair or a bill is due, they actually pay that bill for you on your behalf. But that's a really great resource. And so it's amazing that our program is able to support team members for the first 90 days. And then if they still by chance need support after that, there is another department or area within the organization that can help them after that 90-day period. So that transition and those referrals have worked out really well. Again, more with financial literacy, because that certainly is a need, and we'll get into more of that in 2023, kind of like the second phase of what we're doing with coaching. We're incorporating more of the career development discussions, talking more about education benefits and goal setting, and then post-program support. So I'll talk a little more about post-program support in a second. So that's the support that we offer. We also have several touch points. One of my goals was to ensure that the program was very high touch and that we stayed in constant contact with team members. One, whenever they needed us, we wanted them to know that we were available, but we also wanted to be intentional and do some of that outreach on our own. And so we've kind of built some of that in. So onboarding, day one, their very first day of work, orientation, we are there. We do an overview, we introduce ourselves as I'm your coach. This is what success coaching is. This is how I can help you. This is the support that we offer. So we do that in a group setting. And then at the end of that day, the team member takes an assessment or an intake form, or they complete an intake form. Within the assessment, we are able to determine what some of their needs are. And a lot of the intake questions are based on social determinants of health. And so we ask about transportation and food and childcare. We ask about safety, the number of jobs that they've had, if they are coming from a community organization or have a case manager. So those are some more retention related questions. But based on how they respond, their responses get a weight. And that's how we determine which team members are high need versus low need. And that's internal terminology. The team members do not know that we are referencing them in that way. Also, all team members get the same support, but it's really just helpful for our coaches to know what team members we may want to pay a little more attention to, may want to ensure that they have what they need, do more follow-ups with if necessary. But we're able to identify our high versus our low need team members on day one through this assessment. Day two, we do a one-on-one with our success coach. So they meet with the team members individually. They've already reviewed the intake, and then they're able to put together a support action plan. These are I reviewed your intake. I see that you may have some needs. This is the support that we can offer. And then this is an action plan for you going forward, connections to other resources. This is how we can help. So we actually build a plan for them that we're able to put together on day two. And then we do 30, 60, and 90-day check-ins. So those are formalized, scheduled one-on-one meetings that we have with the team members. And then at that time, the team members also complete an electronic survey. So we want to just assess like what their experience is with the job, how their training is, how their supervisor is, their satisfaction with the coaching and the program, if they have any additional needs, and also how we can be of better support. And so they complete a survey, which is a little different each time at the 30, 60, and 90-day mark. In addition to those touch points, we do some mid-month wellness checks, and that's actually something new that we're incorporating this year. But we got feedback that some team members were like they would actually say on their 90-day assessment or their 90-day survey, I wish I had talked to my coach more, or we should have had more meetings. Or the coach would pass a team member in the hall and they'd say, hey, I haven't talked to you. And he's like, well, your 30-day or your 60-day is coming up. And so we sense that the team members actually want to be connected more with their coach. And so we're intentional about doing more outreach at the mid-month mark, where we just send a really quick message to say, hey, this is your coach. How's everything going? Do you have any needs? Is there anything I could do to support you? And so we just started incorporating that, and hopefully we'll be able to just stay connected a little more. We also do meetings as needed at the request of the team member. And then we do some post-program follow-up, and there's a slide on that in a second. So those are the ways that we are able to stay in contact with the team members. This is just an example of the support action plan. We are using a system called OnBase, and so we like customized our tracking process and the way we collect data. And so this is just an example. We've actually done a couple more versions since this, but we're able to identify how many resources are remaining or what balance is still available for a team member in the categories of food or transportation or childcare, what's been utilized. We could put notes in here, note whether or not it was approved. And so we've developed some really great processes for tracking our progress. As it relates to our post-program check-ins, I'm super excited about this because we noticed that as team members were released from the program, several of them still had needs. After that 90-day, some of them still needed a lot of support and maybe were going through some challenges. They can still reach out and connect with their coach. They do not still qualify for the funds like the venture cards or the grocery vouchers or what have you. But we still are able to work with them and connect them to resources. But we wanted them to have a person post-program who could work with them, connect with them, do check-ins, and just make sure that they were okay. What we didn't want is to say, we've given you all this love for your first 90 days. Your 90 days are up. See you later. We wanted them to know that we still value them as an employee. We still want to help if there's a need. And so we introduce our consultant, Latrice, who is in charge of our, what we're calling PPCI process. And so post-program check-ins. All team members will get post-program check-ins. But those who are released at the program and are still high need, still have needs, she'll do a check-in with them at the 2-week mark, and then she'll do another check-in with them at the 1-month mark. And then any other check-ins beyond that really are based on how the conversation goes, what some of their goals are, what some of their needs are. And so we'll just kind of determine how much contact we still need to maintain. But we're excited about this process, and we'll actually start on the 27th of this month. We'll pilot it or try it out with a couple of team members who are at that 120-day mark. All right, so one of the last couple of sections is going over just the data highlights, just so that you can see what some of our successes are and what we have been able to accomplish with the program. So as of today, we are at 86% retention for our team members. 71 team members have started and gone through this program, and we've had 10 losses. 65% of them were identified as high need. And we've expended just about $4,700 in support for 31 of the 71 team members. $944 in clothing, $2,300 in food, and about $1,400 in transportation. This is just a snapshot of our very first group of team members to go through that 90-day cycle, just to give you an idea of what it looked like from just this first group. And it was a larger group. On August 1st, we actually had 12 team members start. And so we had 3 losses out of that group. We had a 75% retention, 83% of them were high need, 67% of them utilized support. We expended about $1,500. It was about $189 on average per team member, which is not a lot. The most we awarded one team member was $440. So exceptions were made. The least we awarded was $30. And then this is just a breakdown of the support that we offered them. We did some assessments. 100% of them thought that the program was beneficial. 100% would recommend the program to other team members. And so we were so excited about our first pilot group. I can say that our success has continued. We've been able to offer the same great support, but even more enhanced as we were adding to the program day by day. I thought that this was really an important graphic to share with anyone who is learning about coaching, considering doing anything similar. I wanted to just show a breakdown of the support, because sometimes the question comes up, well, do you find that team members are taking advantage and they're just asking because you're offering? And the answer really is no. As you can see here, 78% of the support that we offer is within the first 30 days. And that really shows that team members really just need a hand. They really just need some support to get on their feet until they get their first couple of checks, and then they're fine. As you can see at the 60-day mark and then the 90-day mark, it continues to trail off in terms of the support. And it doesn't trail off because we don't offer it anymore. It just trails off because they no longer have a need. Up until that 90-day mark, every day they can ask us for support and resources if they choose to, but they just no longer need it. And so just to note here, most of the support does occur within the first 30 days. Team members are not making requests that they don't need. And then on average, we have expended about $152 per team member, as little as $30, as much as $440. And so to offer this level of support, I definitely think it's a great investment. And it, obviously $150 per team member is not a stretch for a lot of you, maybe. I also wanted to show you this. We've really been like diving into the data since we launched in August, trying to identify trends. And I thought that this was really important too. This is just a breakdown of the top 10 team members and the amount of support that they received. Obviously, it didn't include their information, but the top 10 in support, the top 9 are actually still employed. And number 10 left the program after the 90-day period. So those who we have supported have stayed. Also, only 3 of those who were termed received any support from us at all. So out of the terminations, those 10 that left the organization within that 90-day period, only 3 of them received any support, and 5 of them, half of them, actually opted out or declined support from our program. So those that we supported and helped, they stayed. And I believe that this is really great proof that the efforts that we're making within the program do support retention. And those who are not really active in the program, who are not taking advantage of the support of a coach, those are the ones that are leaving. So this was really important data that we were able to just collect and pull out this week. This is an example of how we are doing some tracking. Ramian, who is our coach at Christ, is incredible. He builds databases for fun, and he has created a custom database for us that really tracks everything that we could ever think of. So our inventory is tracked, our support requests are tracked. Over here, you could see, like, we could click these buttons and view the team members, the resource list, check-in calendars, or what have you. So the way we collect data really is just incredible, and it makes the process so much easier. These are just some snapshots of some of our data for the 71 team members that we're supporting. We also have race information and gender information and age information and all the demographics as well. But this is just a snapshot in terms of the support. Food is definitely at the top each time. Most of our team members are high need. Most are getting cafeteria vouchers. And then we are able to automatically calculate our retention. This I wanted to show you as well, which I think is so incredible. Ramian is so great, but we wanted to make sure, especially going into this next year where we'll have a full year of coaching, that we stay on top of how we track our check-ins, that we're diligent about completing our check-ins. And then also, if we want to do those wellness checks, like, we need to stay on top of it. In managing a caseload of team members, that could be complicated. And so he created this, or built this calendar for us. And so when you click on a date, it will actually open up the record, and it'll show you, if you can see just down at the bottom, this is what opens up. It'll tell you what check-in is due that day, the team member's name, their preferred method of contact. It includes their number, their email, at work and personal, and then the check-in date and the wellness check-in date as well. There's also a wellness calendar so that they could see both. And then also too, like, he actually linked to Google Voice. So when you click the phone number, it opens up Google Voice, which is how we do our phone calls and our text messages. When you click on the email address, it links straight to email. So it just makes the process for staying in contact with team members, connecting with them, and staying organized with the process so much easier. So it's really been incredible. And then in terms of sharing information and staying connected, I created a web page for the program, which we're just going to start utilizing this month. If you could just let me know, can you see the page? Okay. So very quickly, this is just an overview of the page. It has program information about coaching, resources, FAQ here. This is where a team member can come and actually meet their coach. they can click here and actually book an appointment with their coach. We're using Microsoft Bookings. They can book what type of appointment they want, select a day, and it automatically goes onto the coach's calendar. So they can learn about who their coach is. FAQ is here for anyone within the organization who has questions. We have a resource page. This is really great because this page will be available to anyone within the organization if they, have questions about any of the support listed here. And so our primary resources now are for the Chicagoland area, but the goal is that we scale the program into other sites, into other areas, and we'll continue to add resources. But for housing, for food, we've linked different resources and programs. And actually, all of the resources that are listed on this page, I have literally personally vetted to call, to know what the process is, to know who they talk to, what button to push, what the times are. So all the information is available here. And then there's the participant page. And so a lot more details listed here, but they can meet their coach. They could schedule their check-ins. They can complete their check-in surveys straight from here. They can learn what emergency assistance is available and actually submit a request form. So when they have a need, we actually do a formal request process. So it just kind of walks them through that. Mental and emotional support, other additional resources are listed here as well. And the last thing I want to note is we incorporated something new this year. It's a suggestion box. So they can go on here and just leave anonymous feedback or comments. And I think that this is important too, because there may be things that they don't necessarily want to tell their coach or their leader. And so for them to have a place to go where they can submit information anonymously, we're excited to see what comes through there. And then there's also a process for leaders to refer team members to a coach. So if there's a team member that they want to refer for whatever reason, they can provide some additional information about why they're referring, and the coach will get a notification and actually reach out to the team member. So this is the success coaching page. Oh, shoot, sorry. And then truly the last thing that I have really are some of the lessons learned. Cooperation from departmental leadership has been very critical, creating a relationship with them so that they can support us in the work that we do. Being on site and everything has been really important. Coach participation and orientation really improves engagement. When they're able to connect with their coach in that day 1 and day 2, it's really been beneficial. We've noticed that team members who were not connected to the coach early on are the ones who had a harder time staying engaged with the program. Team members are eager to share if we ask. We thought it would take time to build rapport and develop a relationship before they just shared all of their personal information with us so we know how to help. On day 1, you're asking them questions just about how they're doing and what their needs are, and they are telling us. And so they're eager to share. We just have to be open and willing to ask. We've had some legal restrictions that have limited our ability to reach out to team members. We were going to do something called mobile coach where we could text them throughout. We weren't able to do that. And so being able to communicate with hourly employees has been a challenge, like off the clock. And so we had to get creative about how to finagle that and still maintain contact. So those wellness checks and the other things that we do on site has been beneficial. Really surprisingly, childcare has not been utilized at all. So we offer it and not one person has asked for it or needed it. And we thought that that would probably be one of the highest utilized needs. So that was a lesson learned for us. And then also resources are often unknown and not easily accessed. So we have a ton of resources internally for all team members, but if you don't know where to go for it or you don't know it exists, it's useless. And so hopefully having that resource page and having coaches who are able to kind of remind team members of what some of the benefits and resources are that'll help them stay better connected to what we offer. And then lastly, our impact. So I wanted to just share a few stories about some situations where the program has proved beneficial. I already talked about this, but our program is fluid. And so we want to respond to whatever needs arise. That's why when a need arises and we can support it, we add to the resources and support that we offer. So when a team member came up to Ramian on the very first day of coaching to say, I'm supposed to wear Black, but I don't have it because my child's father was just murdered. We're living with someone. I don't have all my clothes. What I have doesn't really even fit, and I have nothing Black. I don't have any money. Like, I don't know how I'm going to wear Black to work for the next month. We were able to get on a phone call with Michele, with my manager, and come up with a solution. And so now we offer an inventory of Black clothes. Same thing with a Goodwill voucher and the team member who was homeless and didn't have shoes. Like, how can we support? How can we be innovative about the support and resources that we offer? And that's where the Goodwill partnership came about. One of our greatest success stories is a team member who was homeless. We found out in a survey, she said she was working overnight shifts so she would have somewhere to be at night. So we really got on it to help her identify support and resources. But she utilized almost every single resource that we offer within the program. We helped her a ton. And at the end of her 90-day, she was able to save enough money to get a security deposit on her own apartment. And she bought a small car so she could get back and forth. And so a hand up, not a handout is actually Goodwill's motto. But that's what we do. We really just get them on their feet. And that's one of our greatest success stories. And we're really happy we were able to provide support that helped this team member. Domestic violence has been huge. As a result, we have developed a threat assessment.
It looks like Bridgett is frozen. But yes, are you back, Bridgett?
Oh, yeah. Can you hear me? I'm sorry.
Yep, we can.
Okay, I'm sorry. So I was just saying, we have a threat assessment team in place, a domestic violence protocol, and we added a safety question to the intake as a result of that situation. So another example of how we are responding to needs. And then lastly, in our one-on-ones, we are just learning so much about team members. And this is on day 2. Ramian was able to tell a team member how proud he was. She didn't finish high school. Her mom died. Her brother was murdered. Her grandma died. She was living with family and friends. She just had the hardest life. And he was just telling her, I'm really proud of you for, despite your circumstances, still wanting to work. And you work at a great organization. Like, I'm so proud of you and the path that you're on. And she broke down in tears because she said no one had ever told her that they were proud of her before. And so I feel like the impact that we have with team members is sort of beyond what we can give them and like financial support. Really just to be an encouragement has been so beneficial. And we're learning about mental health challenges. When we talk about EAP, people are coming to our coaches afterwards to say, hey, like, I've kind of been struggling with depression. Like, do you think that there's a counselor who could help me? I didn't know that EAP even existed. So the fact that we're able to talk about resources and then the team members are comfortable enough to come to their coach with questions, I think is impactful. This is just a quote from a team member who said the program was great. We were able to help with barriers like housing and financial. And then she talked about how the program is really good for new hires. It makes you feel like someone really has your back and wants the best for you. It's wonderful. So it is a wonderful program. I'm really excited. It's one of the most fulfilling things I've ever done. And I am super excited to scale the program, have it available at more sites within Advocate Health, and be able to help more of our team members or now teammates is what we'll call them. But that's it. I know I said so much, but obviously this is an opportunity if anyone has any questions. I'm glad Michele is on the call because she's able to respond to questions as well. But if you have any, let us know.
Thank you so much, Bridgett. This is it's amazing program and unique. I don't think I've seen anything like it at other healthcare providers or even other employers in other industries. So let me just applaud what you both are doing, what your whole team is doing. And thank you for all this information. I wasn't expecting to see so much great data and report out. So thank you for sharing.
Mm-hmm.
Thank you for doing what you're doing. We have a relatively small group, so I encourage everyone to, get on camera, just ask questions, have a little bit of discussion at the end here. I have so many, but I'll kick us off with the first question, which is, I know a lot of the people that have been able to join this call are more on the community organization or training provider side of the coin. And a lot of us are in positions where we're trying to sort of prove the value of making investments like that with the employers that we work with.
Mm-hmm.
Sort of a two-part question is first, could you speak a little bit more to how you got the internal buy-in for this program? And on the other side of the question is, you're collecting all this data and looking at it. Are you compiling some sort of like return on investment, sort of, equations? I know making this business case is really important, and seeing at the low number of, monetary investment. I know, the coaches are a separate, a cost as well, but the actual monetary investment is negligible compared to the cost of hiring someone new and onboarding. So A, how did you get the buy-in, and B, what are you planning to do from moving forward from this? What are you trying to invest in the future?
So I'll take the first part of the question and then I'll hand it over to Bridgett. If you're good with that, Bridgett, I can answer.
Yes, that's
Okay.
fine.
All right, so I'll hand over the second part. So the first part, so we didn't ask for new dollars. So I will be very transparent in the sense that we were asking to have a green light to pilot this with funds we already had in our budget. So I proposed utilizing dollars that we had previously allocated in different ways to support something for our internal teammates. And so the ask was probably less of a monetary investment from the organization having to find new dollars. I think we can all appreciate that. If you say, hey, I have the money, I'm just asking, can I use it in a different way? It's a lot different than saying, I want to do something new and I need you to find some money for me to be able to do that. So we took away that second barrier, and I said, we're going to reallocate dollars we already have within our budget to see if we can, stand up a team member success coaching program and provide wraparound support to our internal teammates. Something that Bridgett touched on, but we actually had a survey that was conducted for a couple of our patient service areas to kind of get at the heart of what we provide this program for. Now, the intention of that survey had nothing to do with the success coaching program. They conducted this survey because they were having high turnover, feedback amongst leaders and teammates that were sharing some perspectives, and then annually we do an engagement survey. We're centered around a lot of the things that we are providing support. So the purpose of the survey was to get at the heart of what are teammates experiencing in their personal lives and their professional lives that are impacting their ability to stay at our organization. And from that, they found, and keep me honest here, but I want to say that something like 10% of the people who completed that survey said they had housing insecurity. They didn't know where they were going to sleep at night. They had food insecurity. We had a leader in particular who had a teammate that was in support services. I think that this person in particular was up in Wisconsin, who shared she had brought her child to work on night shift, something she had never done before. The leader was ready to let her go. Upon further inquiry, they figured out that she had a house fire and they didn't have anywhere to go, and she had no choice but to bring her child to work because she was like, I can't leave my daughter in a hotel in the middle of the night by herself. So they were able to provide an intervention and find this teammate housing, but that could have been something that if nobody ever asked her, why did you bring your daughter to work? Because it was uncharacteristic, she could have been terminated. So in addition to having nowhere to live, now I don't have a job. So I say all that to say it supported the intention behind why we wanted to create this program. So I would say the leader buy-in wasn't difficult because we have a crisis fund for individuals that have been here 90 days or more, which spoke to, we have a need as an organization to support people aside from benefits and their salary. And so we had data from our crisis fund to support that already. We actually met with the team for our trauma center, and all of the things that they are providing for individuals in the community. Those are people who work for our organization. So while they're members in the community that have experienced gun violence or some form of violence, either from themselves or immediate family member, those are the individuals that live in the communities that we serve. And so I would say getting the support from our leadership, because we weren't asking for dollars, was fairly easy. But also the data substantiated it from a number of different, avenues. We have an annual engagement survey, our leaders in 2 of our patient service areas conducted a survey, trying to understand team member or teammate experience better. And then just anecdotally, stories that people had across the organization about, challenges that people have in their personal lives that impact their ability to work, and us responding to that and removing those barriers so that they can be successful and retain and build a career here. And for the second part, I'll hand it over to Bridgett.
Yeah, that was great, Michele. And we definitely hope to be able to scale the program. That's why we are collecting data in the way that we are. I mean, we're literally tracking everything. And we also want to be able to tell the story. And so we are focusing also this year on getting testimonials from team members, getting that feedback, so that as we look to scale, we can make a case. And then obviously our efforts towards retention, we're collecting and tracking that, and that's going to be important and critical. But I don't think it's going to be a hard sell. Anytime a leader or someone at a different site learns about what we're doing, everyone is interested. But we haven't had a full year to collect data. The first several months that we launched, we were learning, sort of building the plane as we were flying and making adjustments. And now that we have a good process and system in place, it's really going to be a data collecting year so that we can, get those good retention numbers, show the data, and be able to launch coaching at several other sites and also within several departments, even at the sites that we're at.
And one thing I will add to what Bridgett said, April, is she said, we're really diving into the data this year. One of the pieces that we are looking is comparatively, individuals that started. I love that, Bridgett shared, there were 5 out of the 10 that opted out of having a success coach, and the retention of those individuals was less than those that opted to have a success coach. And so we're looking to provide a comparison of individuals that have started in the same time frame as our success coaches, even potentially at another site, in comparison to the retention of those individuals that have been linked with a success coach, because we know our frontline workers are honestly the heartbeat of the organization. Without them, none of the operations can happen. And so making sure that we're sharing with leadership that investing $175 in a teammate is really nothing to our bottom line when you really think about it overall, because in terms of the benefits that we provide for healthcare, for dental, for vision, is far above $175 per person for somebody to be able to have lunch, for someone to be able to feed their kids until they get their first paycheck, and to not quit because they don't have a black t-shirt.
We're almost at time. Mary has asked about the Navigate program in the chat. I believe you still have the Navigate program, right?
Yes, we do still have the Navigate program. And so we've actually scaled our Navigate program across our Midwest. So I say Midwest because for those of you that don't know, we've merged with the health system in the Southeast, Atrium Health. So I have to be mindful to say it's scaled in the Midwest. And so each of our PSAs run our Navigate program. So Navigate is actually a self-nominating. So we allow team members to raise their hand to say they want to participate in that. But it is something I do believe, you know, and again, keep me honest here, that our success coaches do share that as part of that success coaching program, so that we can align them with future oriented resources, and they are aware of all of the benefits we provide our teammates, even after they've, you know, achieved their 90-day and are no longer actively participating in our success coaching program. But yes, we still have Navigate. It is thriving. I have two Navigate graduations to attend next week, and looking forward to it.
Mhm. Yep. And in the last minute, if I could say, one of our coaches, Tanisha, actually worked in EVS at Christ for 13 years. She's been with the organization for 18. She is amazing, but she was never presented any information about Navigate, didn't know that it existed. And she is incredible. And so I feel like that is also another benefit of having the coaching program, so that we can tell them about what upskilling opportunities and professional development opportunities are available to them. In case their leaders are not sharing that information, they have a coach who's invested in their future, in their goals and their education and the things that they want to accomplish. So yes, that is definitely part of what we do. Mm-hmm.
I know we're at time. I just dropped a link to a very quick survey in there. If those who came could take a moment to fill that out. I will send out the recording to everyone who's registered. Bridgett, I hope you'll send me the slides so I can include those with it. Thank you. Thank you, both of you, for the time you spent to prepare for today. I found it very illuminating, and I really hope a lot of other people also watch this recording to learn about this fantastic program. Thank you all. Have a great week, and hope to see some of you tomorrow. Dina, who had to drop off early, is actually on our panel tomorrow. So was Rukia, who hosted our first Lunch and Learn series from Rush. But thank you all. Have a great day.
Thank you.
Thank you, Bridgett. Thank you, Michelle.
Thank you.